In this video, we'll discuss some uncomfortable truths about men living with diabetes. Now, a little warning, what you're about to hear is a sensitive topic for a lot of men, but it may also motivate you to get your blood sugar under control if you have diabetes. So let's see how diabetes affects men, what the complications are, and how to avoid all of the negative fallout. First, let's start with the physical symptoms, from blurred vision, increased thirst and hunger, going to the bathroom more often, and feeling tired for the better part of the day. It's taxing, to say the least. And mentally, you have blood glucose at the back of your mind all the time while never being able to let go and try new foods without wondering about their carb content. It's a huge mental load. But as some male diabetes patients know, the problems also extend to the bedroom since they may have erectile dysfunction caused by the condition. Here's a staggering statistic that may shock you. According to a 2017 comprehensive review of 145 studies, more than 50% of men with diabetes have some form of erectile dysfunction. That's half of all male diabetes patients. Now keep in mind that this is just the cases with an actual diagnosis of diabetes. That number may be even higher once you take undiagnosed cases into account. So how does diabetes lead to erectile dysfunction? This is your autonomic nervous system, or ANS for short. It's also called a vegetative nervous system since it controls a myriad of unconscious processes in the body. One of them is regulating when your blood vessels widen or constrict. Diabetes damages the nerves and blood vessels in the male reproductive organ. And when this happens, it often results in problems achieving an erection. However, diabetes doesn't just stop here, it also stunts fertility and motility. This is because glucose metabolism is important for spermatogenesis, or the body's ability to create male reproductive cells. Diabetes affects their quality, motility, and DNA integrity. The condition may also be passed down to future generations, which increases the risk of developing diabetes in your offspring. The effect of diabetes on male fertility has been documented in many studies, including one that showed 16% of the participants had primary infertility. Now let's examine another factor, stress. In a large Swedish study by the University of Gothenburg, starting from the 1970s, researchers studied 7,500 men born between 1915 and 1925, and after 35 years, they followed up with them to find out if long-term stress raised the likelihood of diabetes. The men who reported permanent stress in their work or private life had a whopping 45% higher risk of developing diabetes. And this is why lowering stress is a good strategy to push back against symptoms of diabetes, as this 2018 study shows. But another thing I want to talk about is how diabetes originates differently in men and women. While it shouldn't come as a surprise that men tend to store more fat in the abdominal region, while women store it in their glutes and their upper legs. But research now shows diabetes depends on where that extra fat goes. This is because diabetes is closely connected with abdominal fat. You see, women store fat just under the skin, which is known as subcutaneous fat, and their fat cells tend to multiply and increase in number. However, men mostly store extra fat around the organs, which is known as visceral fat, and their fat cells expand and get bigger. This puts them at higher risk of the disease. A large 2016 study of over 480,000 patients showed that men with type 2 diabetes had a 9-centimeter wider waist than men who didn't have the disease. They also had a 3-point higher BMI. Thanks to having more hidden visceral fat around the organs, men who don't appear to be overweight or obese could also be at risk. The takeaway here? Well, losing weight is one of the best ways to fight diabetes. All right, so here comes the main question. What should you do to avoid all these diabetes complications? Well, first, you need to take better control of your blood glucose levels. And secondly, if you're carrying excess fat around the abdomen, your next step is quite obvious: to lose that extra weight. Beyond standard advice like proper medication treatment and a low sugar diet, there's also merit to doing resistance-based exercise. Higher muscle mass leads to improved insulin sensitivity and blood glucose control. If you take all of these initial steps, I'm sure you'll manage to keep your diabetes and your overall health on track. For other science-based tips, have a look at the other videos on our channel. Thanks for watching, and we'll see you next time.